Welcome back to the deep dive. You guys sent in some really interesting research on parathyroid cysts, and we're excited to unpack it all with you today.
These are really quite fascinating lesions.
Yeah, they don't get nearly enough attention, I think.
Right. Because they're these little fluid-filled sacs that typically pop up in the neck.
Yeah, or even more rarely, the mediastinum.
Exactly.
So we know most cases of primary hyperparathyroidism are caused by adenomas, right? But these cysts, they present a whole different set of challenges.
Absolutely.
So get ready, because today we're going to uncover some pretty cool stuff about how these cysts form, what they look like, and how they can impact your health.
You know what I find particularly interesting about these cysts? It's that they can arise in so many different ways.
Oh, yeah. Tell me more.
And each way has unique implications for how we diagnose and treat them.
Okay, so let's break that down. The research you sent outlines 5 distinct types of parathyroid cysts, each with its own kind of origin story.
That's right.
So some develop from remnants of embryonic structures, like branchial clefts, while others form from the fusion of these tiny microcysts.
Right.
And then there are those that arise from degenerating adenomas,
Uh-huh.
or simply from fluid buildup.
Yeah, and those are the more common ones you see.
Yeah.
But the ones that I find really fascinating are those that originate from remnants of Kersteiner canals.
Kersteiner canals.
Yeah, these are tiny tube-like structures that are present during embryonic development.
Okay.
And they usually disappear, as we develop.
Yeah. But sometimes remnants can persist
Oh, wow.
and give rise to these unusual cysts.
That's amazing. It's like a little piece of our developmental history is just hiding out in these cysts.
Exactly.
But why is it so important to understand these different origins? Does knowing where a cyst came from really change how we approach it clinically?
Absolutely. Imagine you're a doctor. You're examining a patient with a neck mass, knowing that the mass originated from a Kersteiner canal as opposed to, say, a degenerating adenoma. That can significantly influence your diagnostic approach
Oh, I see.
and your treatment recommendations. Yeah, that makes a lot of sense. So, okay, I'm starting to see how understanding the origin story of these cysts can be a game changer in the clinic. But let's talk about how these cysts actually show up. What kind of symptoms do they cause? And how are they usually discovered?
But that's one of the intriguing things about parathyroid cysts. They can be incredibly sneaky.
Oh, really?
Some are completely silent, discovered incidentally during imaging for something else entirely.
Wow, so they're just kind of hiding out.
Yeah, it's like they're hiding in plain sight
Yeah.
until they decide to make their presence known.
So you might just stumble upon one by chance during a scan for something totally unrelated.
Exactly.
But there are times when they cause more noticeable problems, right?
Right, when they get large enough, they can start to push on surrounding structures, leading to a range of symptoms. We're talking about difficulty, breathing trouble, swallowing hoarseness,
Oh, wow.
and even in rare cases, vein thrombosis.
That sounds pretty serious. The research mentions that over 85% of these cysts occur in the neck. Is location a factor in how they present and what kind of complications they cause?
Absolutely, location is key.
Yeah.
A large cyst in the neck, for example, could compress the trachea or esophagus,
Right.
causing those breathing and swallowing difficulties you mentioned.
Oh, wow.
And the fact that the remaining percentage can occur anywhere from the jaw down to the mediastinum,
Oh, my gosh.
that adds another layer of complexity to diagnosis and treatment.
So it's not just about the cyst itself, it's about where it decides to set up shop.
Exactly.
That's wild. Okay, now let's get into this fascinating distinction between functional and non-functional cysts.
Wow.
I understand it has to do with whether or not the cyst is producing parathyroid hormone or PTH. What's the significance of this difference? And how does it impact a patient's health?
This distinction is crucial. Non-functional cysts are generally well-behaved.
Okay.
They don't produce excessive PTH and often go unnoticed. They're more common in women
Got it.
and are usually discovered incidentally.
So they're the quiet ones.
Exactly.
But functional cysts are the ones that can really stir up trouble, correct?
Right. That's right. Functional cysts are the ones that can kick PTH production into overdrive,
Oh.
leading to hypercalcemia, too much calcium in the blood.
Right.
And this can cause a whole cascade of problems,
Like what?
from fatigue and nausea to kidney stones and even bone fractures.
Wow, that sounds pretty intense. Does the research mention any specific cases that illustrate just how potent these functional cysts can be?
There's a study that looked at 325 patients undergoing parathyroid surgery.
Okay.
Out of those, 11 had parathyroid cysts.
Okay.
Now, here's the interesting part. 2 of those patients had severely elevated calcium levels. reaching as high as 17.1 milli-GDL.
Wow.
And they also had extremely high PTH levels. This goes to show that even though parathyroid cysts are relatively rare,
Yeah.
they can pack a serious punch when they're functional.
That's a powerful reminder that these cysts, despite their small size, can have a big impact on the body. But what drives this difference in behavior between functional and non-functional cysts? Why are some quiet and others so disruptive?
Well, researchers believe that functional cysts often arise from degenerative changes within parathyroid tumors.
Interesting.
It's like the tumor cells go haywire,
Uh-huh.
causing the cyst to overproduce PTH
Oh, wow.
and throw the body's calcium balance out of whack.
So it's like a domino effect.
Exactly.
Okay, so we've got these different types of cysts, some stealthy, some causing major problems. But how do doctors even go about diagnosing them in the first place? I imagine it can be tricky to distinguish a parathyroid cyst from other neck masses.
You're absolutely right. Differentiating a parathyroid cyst from other neck masses like those arising from the thyroid gland can be challenging.
So what's the process like? I mean, imaging techniques alone aren't enough.
Imaging techniques like CT scans and ultrasounds,
Yeah.
they can provide valuable information, but they often fall short in providing a definitive diagnosis.
So even system scans, which are commonly used to pinpoint the location of parathyroid glands, can be unreliable when it comes to cysts.
Exactly. That's why aspiration of the cyst fluid
Okay.
and analyzing its PTH content, that is the gold standard for diagnosis. It's like peering inside the cyst to see what's really going on.
So we're looking for elevated PTH levels in the fluid to confirm our suspicions. But the research you sent mentions that PTH levels in the cyst fluid can vary quite a bit. What's the significance of that?
The PTH concentration in the cyst fluid can actually tell us a lot about the nature of the cyst.
Oh, really?
Non-functional cysts tend to have lower PTH levels,
Okay.
while functional cysts can have PTH concentrations reaching millions of picograms per milliliter.
Wow, that's a huge difference.
It is, and this difference in PTH levels helps doctors differentiate between the two types of cysts.
So we're not just looking for the presence of PTH, but also paying close attention to the amount.
Right.
It's like a secret code that unlocks the true nature of the cyst.
Exactly.
And how does this information actually help doctors decide on the best course of treatment for you, the listener?
Well, imagine you have a cyst,
Okay.
and the aspiration reveals a very high PTH concentration. This strongly suggests that the cyst is functional and contributing to your hypercalcemia.
Oh, I see.
Armed with this knowledge, your doctor can then make a more informed decision about the best treatment strategy for you, whether that involves surgery or other options.
That's right.
It's all about connecting the dots and using that information to make the best decisions for each patient.
It's like detective work almost.
Exactly.
Okay, let's shift gears a bit and delve into what these cysts actually look like under a microscope. What are some of the key features that pathologists look for when examining a parathyroid cyst?
Parathyroid cysts typically have a smooth inner lining, composed of a single layer of cuboidal epithelial cells.
Cuboidal epithelial cells. Interesting. What does that actually look like?
Think of it like a neat and tidy layer of bricks lining the inside of the cyst.
Got it. And importantly, malignancy in these cysts is quite rare.
Yes, very rare, which is certainly reassuring for patients.
That is good to hear. But the research did mention something about atypical cystic parathyroid adenomas. What are those, and should we be worried about them?
Atypical cystic parathyroid adenomas are a bit of a gray area.
Oh, really?
They share some microscopic features with cancerous cells,
Okay.
but they lack the hallmarks of true malignancy, like invasion into surrounding tissues or spreading to distant sites.
Got it.
So while they're not considered fully malignant,
Okay.
they do warrant close monitoring.
So it's like they're sitting on the fence between benign and malignant,
Exactly.
and we need to keep a close eye on them.
Right.
Okay, now let's get to the part that I'm sure is on everyone's mind, treatment. What are the options available for managing parathyroid cysts? And how do doctors decide which approach is best for each patient?
The go-to approach for symptomatic or functional cysts is surgical resection.
So that involves removing the cyst completely.
That's right. And this often resolves the associated symptoms and normalizes PTH levels.
So surgery is the most definitive way to get rid of the problem. But what about cases where surgery might not be the ideal option? Perhaps due to the location of the cyst or a patient's overall health? Are there less invasive alternatives?
Absolutely. Aspiration is a less invasive procedure
Okay.
that involves using a needle to drain the fluid from the cyst.
Got it.
What's interesting is that in some cases, aspiration alone can be curative.
Oh, really? Just draining the fluid can sometimes solve the problem.
especially for non-functional cysts.
Wow.
There have been cases where patients with non-functional cysts experienced complete resolution after a single aspiration,
That's amazing.
while others needed a second procedure.
Okay.
Of course, there's always the possibility of recurrence,
Right.
and in those instances, surgery might become necessary.
So it's kind of like a test run.
Yeah,
If aspiration works, fantastic. If not, there are other options on the table.
right.
Speaking of other options, what about sclerotherapy? I understand it's another alternative for treating these cysts.
Sclerotherapy involves injecting a solution into the cyst to shrink it.
Oh, interesting.
It can be particularly helpful for recurrent cysts
Okay.
that keep coming back after aspiration.
But it's not without its risks, right? The research mentioned potential complications like fibrosis and nerve damage.
Yes, those are important considerations.
Right.
Sclerotherapy is not a risk-free procedure,
Right.
and it's essential to weigh the potential benefits against the possible drawbacks.
It seems like every treatment option comes with its own set of pros and cons. How do doctors navigate this complex landscape and ultimately choose the best course of action for each individual patient?
It's a combination of factors, really,
Such as?
including the type of cyst, its size and location,
Mm-hmm.
the severity of symptoms, and the patient's overall health and preferences.
So it's really a personalized approach, taking all of these individual factors into account.
Absolutely.
Now, there's something that really struck me in the research that I'd like to discuss. It's this idea that there could be a whole hidden population of people walking around with parathyroid cysts, and they have absolutely no clue.
Ah, yes. The silent lurkers.
That's a little creepy.
It is a valid concern. The research highlights that these cysts can often present with very subtle or even non-existent symptoms,
Right.
especially in the early stages. So it's quite possible that many cases go undetected,
Yeah.
particularly if imaging isn't performed for other reasons.
That's a sobering thought. Imagine walking around with a cyst in your neck and not even knowing it. What kind of consequences could this have for those individuals?
Well, let's say someone has a functional cyst that's slowly but steadily overproducing PTH.
Okay.
Over time, this could lead to a gradual increase in blood calcium levels,
Mm-hmm.
potentially causing damage to the kidneys, bones, and heart.
So even though the cyst might not be causing noticeable symptoms right now, it could be silently wreaking havoc on the body in the long run.
Exactly. And that's why raising awareness about these cysts is so important.
Totally.
Early detection and treatment can make a significant difference in preventing those long-term complications.
Now let's shift gears again and dive deeper into the parathyroid hormone itself. We've talked about how it's produced by these cysts and its role in regulating calcium levels, but the research also mentions another intriguing aspect of PTH, its role in bone remodeling.
That's a great point. We often focus on PTH's impact on calcium, but its role in bone health is equally important.
Exactly. The research suggests that the elevated PTH levels seen in functional parathyroid cysts could actually influence bone density and structure over time.
Well, that's a fascinating connection.
Yeah.
It suggests that even if a functional cyst is successfully treated
Right.
and calcium levels return to normal,
Mm-hmm.
there might be lingering effects on bone health that need to be monitored.
It's like a ripple effect with the impact of the cyst extending beyond the immediate issue of calcium imbalance.
Exactly.
What kind of long-term monitoring would you recommend for someone who has been diagnosed and treated for a parathyroid cyst, especially a functional one?
It would be wise to monitor bone density regularly, using tests like the DEXA scans. This can help detect any subtle changes in bone health early on
Right.
and allow for timely interventions if needed.
So it's not just about resolving the immediate problem. It's about taking a proactive approach to long-term health and well-being.
Exactly. It's a holistic approach to patient care, recognizing that even seemingly isolated conditions can have far-reaching effects on various bodily systems.
Absolutely. Okay, we've covered a lot of ground today. From the origins of parathyroid cysts to their potential impact on bone health, we've delved into the intricacies of these rare lesions, unraveling their secrets and shedding light on their significance.
I'm reminded of the famous saying, to study the phenomenon of disease without books is to sail an uncharted sea, while to study books without patients is not to go to sea at all.
That's a perfect analogy. Today we combine the wisdom of medical research with the real-world implications of these conditions, providing a comprehensive view of parathyroid cysts.
And hopefully we've equipped you, the listener, with the knowledge you need to navigate this complex medical landscape, whether you're seeking answers for yourself or simply expanding your understanding.
Now, before we wrap up completely, I want to leave you with one final thought to ponder. We've talked about the possibility of undetected parathyroid cysts lurking in the shadows. But what about the flip side? Could there be cases where a parathyroid cyst is suspected, but further investigation reveals a completely different culprit, something even rarer or more unexpected?
That's an excellent question to ponder. It reminds us that the world of medicine is full of surprises,
It really is.
and that even the most experienced clinicians can encounter cases
Oh, yeah.
that challenge our assumptions and
Mm-hmm.
push the boundaries of our knowledge.
It's a reminder to stay curious, to never stop questioning,
Yeah.
and to always be open to the possibility of the unexpected.
And remember, the journey of discovery in medicine, as in life, is an ongoing adventure.
I love that. And as always, thank you for joining us on this deep dive into the world of parathyroid cysts.
We hope you found it informative and engaging.
We've really gone deep, haven't we? Exploring these parathyroid cysts.
Yeah, we've covered a lot of ground today.
From how they form to how they present, and the challenges of getting a proper diagnosis.
We talked about the differences between those functional and non-functional cysts and how they can impact your health, especially when we think about calcium regulation and even bone health.
But one thing that really stood out to me, or I hope it did to you listening as well, is that there might be so many people out there walking around with these cysts and they have no idea.
Yeah, it's a real possibility.
So it's a reminder to really pay attention to your body and any changes you might be experiencing.
And don't hesitate to reach out to your doctor if you have any concerns at all.
That's so important. Early detection is key. Especially with something like this.
It can make all the difference.
So as we wrap up our deep dive today, remember, knowledge is power.
Absolutely.
And understanding these rare conditions can really empower you to make the best decisions for your health.
It's been a pleasure joining you today.
It's been so fascinating talking to you. Thanks for sharing your expertise.
Of course, my pleasure.
And to everyone listening, we'll catch you next time for another deep dive into the world of medicine and beyond.
Until then, stay curious.
And keep those questions coming.